At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. The current procedural terminology codes, also known as CPT, describes tests, evaluations, treatments, and other medical procedures used within healthcare. There are over 8,000 codes that are published and updated annually by the American Medical Association. CPT codes were created to monitor healthcare trends and have proven to be very useful in the claims submission process. The codes highlight to payers what procedures you need to be reimbursed for as a provider. CPT codes serve as a common language for healthcare professionals and insurance companies. This ensures everyone is on the same page regarding treatments and services, ensuring accuracy in billing, reimbursement, and quality of care. Using CPT codes correctly can help improve patient outcomes by allowing medical professionals to document treatments and procedures accurately. Additionally, accurate CPT coding ensures that patients receive the best healthcare possible. Insurance companies also use CPT codes to determine how much they will pay providers for particular procedures. For instance, using CPT codes for family therapy billing is crucial in the medical process. It ensures that the therapist is paid correctly and that family members adequately compensate for their time. There are 3 categories of CPT codes and they serve different purposes. Category 1. Category 1 codes describe medical procedures and services including surgeries, tests, consultations, and treatments. This category is divided into sections based on the healthcare field they apply to. These sections include evaluation and management, anesthesiology, surgery, radiology, pathology and laboratory, medicine. Each section consists of a range of 5-digit numerical codes assigned to specific services. Apart from CPT codes for evaluation and management, the codes are listed in numerical order. Category 2. Category 2 codes are used to track performance measurements and other activities. These codes are used with Category 1 codes to provide additional information about how the service was provided. For example, a Category 2 code can indicate whether an experienced professional or a trainee provided a particular treatment or procedure. These CPT codes can't replace Category 1 or 3 codes, but rather they provide extra information. They typically contain 5 characters, the first 4 numerical characters followed by a 5th alphabetical character F. Category 3. Category 3 CPT codes report emerging medical services and technologies that don't fit the existing categories. They are used to accurately track new developments in healthcare delivery such as robotic surgery or teledermatology. These codes are designed to provide more specificity in coding, and they also help facilities and organizations track the effectiveness of new emergent medical techniques. Medical coders use CPT codes when filing claims to insurance companies and government agencies. They allow healthcare providers to get paid for their services and help insurance companies accurately track those services. Do note that there's a difference between CPT codes and HCPCS codes. CPT codes are used to describe medical procedures and services. HCPCS codes, on the other hand, are used to identify products, supplies, and services, not covered by CPT codes. Here's how to use CPT codes. Initial coding. For initial coding, CPT codes should be selected according to the type of service or procedure provided to a patient. Selecting the correct codes is crucial because it affects the accuracy of filing claims. Verification and submission. Once the codes for service have been chosen, they should be verified against the official CPT coding manual, which stands as a guide for CPT codes. This helps avoid any delays in processing claims. After verifying the codes, you can submit them to insurance companies or government agencies for reimbursement claim processing. Once the codes have been submitted, the insurance company or government agency will review them to ensure they're accurate and used correctly. The CPT codes are then used to generate an explanation of benefits that details how much money the patient or provider will receive from the insurance company. Research. CPT codes help researchers track patient outcomes and the effectiveness of treatments. The codes can also be used to compare services across different healthcare providers. To learn more about CPT codes, explore our guides library, which you can find on our Carepatron website linked in the description below. Carepatron is a practice management software known for its comprehensive features. Signing up is free, just click on the link in the description. If you enjoyed this video, don't forget to press the like and subscribe button for more content like this.